So, what I'm going to discuss today is what's known as a biophysical profile. You might hear us call it a BPP. This is a 30-minute exam that we do, usually in the third trimester. Sometimes it can be done in the second if it's warranted. Sometimes it can be a little bit shorter depending on the situation, the baby, how they're behaving. We look for 4 main categories. Those categories entail movement, tone, breathing, and your fluid. Each of these categories get 2 points. You cannot get 1 point, you cannot get half a point. It's 2 points or 0 points. We're looking for 3 full body movements, and that is the entire trunk, the head, the lower body. We're looking for that to move 3 separate times. We're looking for tone. Tone is flexion, extension, arms, hands, feet, toes. We're looking for 2 of those. Whenever we're looking for breathing, a lot of parents ask me, how is the baby breathing? It's a mystery. It's not. It's just an exercise that they do. So it's not an actual breath in or out. It's an exercise that they do with their lungs to prepare them. Your AFI is your amniotic fluid. For an AFI here, we measure 4 separate quadrants. This, basically. Pretty simple. We're making sure it's not too high, not too low. If it is either of those, your doctor will discuss it. The tech will not. Don't be alarmed, again, unless the doctor tells you to be. Almost every day, I will have a patient that has either too much or too little. If that is the case, again, just let the doctor discuss it with you. Try to stay calm. I know it's hard when you're pregnant to stay calm. It's hard for me to stay calm, and I'm not pregnant. Some other things that we do typically look at on a BPP, and that's going to be the diaphragm, stomach, bladder, and kidneys. We're going to check these almost every time. These are things that can change, so it's always helpful to look at it and make sure none of those things are changing. We will also always check the heart rate. Another thing is we will look for fetal position. So we're going to say the baby is cephalic, which means head down, vertex, which means head down, transverse, which means the baby is laying sideways, either to the right or to the left. And then you have breech, which means the baby is head up. It is very important that you try to get there on time because we will typically need almost the full 30 minutes, best to show up a little bit early for these. It's always good to eat about 15 to 20 minutes before these exams. It's really going to help the ultrasound tech, and also drink some cold water before. A couple of reasons we might perform a biophysical profile could be from you having gestational diabetes, being overweight, having excess fluid. The baby could be small, the baby could be big. So there's a bunch of different reasons why we would do it. However, the physician is going to be the one that determines the reason for it. I do get asked a lot, are we going to measure baby during a BPP? During a biophysical profile, there are no measurements taken unless the doctor requests a growth. A BPP and a growth are completely separate ultrasounds. These are all really helpful tips to have a successful BPP. Hope that helps.